For nearly 50 years, Biotics Research has been a trusted leader in the nutritional supplement industry. Known for uncompromising quality and innovative delivery systems, the company continues to advance the field through ongoing research, unique formulations, and rigorous quality control. Family-owned with a rich history, Biotics Research is most proud of the strong partnerships it has built with the healthcare professionals. On Adjusted Reality, we talk about living strong, vibrant, and healthy. And that starts with the environment around us, whether it's practice or at home. Force of Nature Pro makes it easy to protect your whole being and those you serve with an EPA-registered hospital-grade disinfectant that's powerful against germs, yet free from harsh toxic chemicals. It's safe on hands, treatment tables, and everyday surfaces while supporting better indoor air quality. Plus, it reduces single-use plastics and costs up to 80% less than many traditional products. If you're ready to align your life, your practice, your family routine with a cleaner, more sustainable future, go to forceofnatureclean.com for home and forceofnaturepro.com for exclusive business pricing and limited time offers. Healthy space, healthy practice, healthy life with Force of Nature Pro. Welcome to Adjusted Reality, a podcast series trusted by the adjusted and brought to you by the Foundation for Chiropractic Progress. In this podcast, we are going to learn from so much on how we can start to optimize our health, but in a fun, relatable way. Join me, Dr. Sherry McAllister, as we welcome public health advocate Hope Sievers. Hope Sievers is a public health advocate, certified health education specialist, and an opioid response leader with more than 15 years of experience promoting mental health, substance use recovery, harm reduction, and community wellness. Her work in regard to mental health conditions, substance use disorders, and recovery makes an incredible impact in our communities. I want to thank you first, Hope, for the work that you do, and welcome to Adjusted Reality.
Thank you so much for having me.
Well, the interesting part about Hope is she grew up in a chiropractic household. And I believe, if I'm accurate here, they valued balance and whole person care as part of it. But I'd like to ask, how did that early exposure that you've had in the chiropractic whole being care philosophy shape how you look at public health perspectives and also how you define quality of life across the communities and individuals that you currently come in contact with?
Yeah, it's a great question. So I think being raised in a chiropractic family really gave me a unique perspective on adaptability and connection. And recognizing that we weren't looking at individual systems, we were really raised to see what's everything that's accumulating to how the individual feels and how we're thriving. So it kind of made me an oddball out when I was trying to navigate becoming a public health practitioner. Because we didn't necessarily have the language for systems thinking when we were children, but as I grew into an adult and in a professional, I really recognized that the nervous system and stress and our environment are all constantly influencing each other. And what I saw happening on the individual level for individuals, as what we've also seen transpiring in our communities are almost one and the same. Of the same dysregulation and dysfunction that the nervous system can have is kind of what we're seeing in our communities, especially when we're talking about mental and behavioral health issues. More so, I think the second part of that question was really when we're looking at quality of life and knowing how people are functioning and how they're connecting with one another and within themselves. And how we're adapting to our environments are really how we're building resilience, because that's really the cornerstone of health. Is how resilient is my nervous system? How resilient is my mental health? How resilient is my family? How resilient is my community to address, what kind of stressors are coming into our way? And then how are we adapting and responding to them, not just reacting? And so the same kind of connection we want to have in our bodies is the same kind of connection I want to find in our communities.
It's really beautiful that you brought up the term nervous system because 5, even 10 years ago, we rarely brought up the nervous system as the impact or the influence that we really need to address, that dysregulation, and how the body is able to overcome some of the environmental stressors that really create this unbalanced piece. So, in your work addressing addiction and recovery, how do you see the connection between the body's physical regulation and a person's capacity for emotional healing and resilience?
The physical regulation and that adaptability piece, really understanding that fight or flight, that, that rest and digest, what we're having, at that nervous system level really does adapt to how we're able to regulate in that space. Um, Understanding that recovery and what I want people to understand about recovery is that that's rooted in safety, the feeling of safety, and being able to calm down our bodies and having the tools to be able to do that. So really, that physical manifestation of trauma and stress, and we know that trauma can go back intergenerational. What you experience today can be something that's been hardwired into your genome, for generations. And then how does that continue to express generation by generation? So sometimes when I talk about substance use and addiction in our community, I really try to highlight that, the foundation of what's happening in our genetic code, and those different genes that turn on and turn off based on what kind of stressors, whether that's an environmental stressor, is that a chemical stressor, is that a highly, emotional stressor that happens in the family that then triggers that cascade of dis-ease in the body, right? When we look at, diseases, and whether that's, in the physical frame or in our mental health conditions, being at dis-ease, not having that resiliency, really ends up having that acute, expression of whatever that conflict might be. So you could have, tennis elbow, you've got inflammation in the elbow, and you're recognizing is this a repetitive pattern, that creates this inflammation response that creates a chronic pain that then inhibits someone's, lifestyle. Let's say, they like to play tennis, they're, handy individuals around the house, they can't lift up their kids because things are hurting. I want people to understand that mental behavioral health is very much the same, as you can have some, trauma that happens emotionally in your life that then becomes this chronic condition. And then eventually we're adapting, whether it's a healthy adaptation or not, to address that stress that we're having. And frankly, that's how a lot of substance use and mental health conditions start. There's an acute situation, and then you have this cascade that then turns into a chronic issue, that I think, we're all trying to regulate around.
It's really important to first and foremost, above all else, is to recognize there's a problem. That I think for everybody out there that's listening, it's a very sensitive, intimate topic about how you're dealing with your mental health. And I really like calling it mental health because it takes it away from mental disease, and it takes it away from being something that is really no different than if you are on a skiing hill and you broke your leg. That's an acute trauma. It's the same trauma. It's just now you're looking at the physical and mental aspect of it, and that's such a beautiful thing because many years have gone by where people have really undervalued the intensity of how we actually interpret what goes on in our lives. Because what happens for some people, they see a trauma, they feel a trauma, and they put it into this category. It's not a big deal. And then there's others of us who see the trauma, our past experience, and like you said, the genomic interplay of what we have that we're working with can be very different from one person to another. But then being able to recognize how does that impact the footprint, or the fingerprint is actually a better way of looking at it, the fingerprint of how we move throughout our framework. And everybody's different. And I think, hope you kind of note that with such an important aspect to it is we have to figure out ourselves. We have to figure it out as an individual, just like our fingerprints. My thumbprint is going to be much different than yours. There's often, however, stigma in or discomfort when individuals encounter these traumas, and addiction plays plays a role in what are some of the things that and I'm going to take it from two sides of the equation. Shifts in mindset, language, or practice for the patient, and then those that are helping that patient. Maybe it's a loved one, maybe it's a healthcare provider. What on both sides, whether it's you, the person suffering, or you, the healthcare provider or support system, what are some of the things that we can do to help the healing process and build a stronger you?
Yeah. So I love that you started and you touched on stigma, because really stigma is the biggest barrier for individuals who are suffering, no matter what they're suffering with. But I'll stay in the lane of addiction and substance use. So in terms of on the individual level, so if you're someone that identifies as having a substance use disorder or struggling with a mental health crisis, is um, being able to really level with yourself and figure out what is it that I'm feeling and how does this express in my day-to-day life. One thing that I really like to challenge people with, because most people tend to think of substance use disorders or addiction related disorders as your heavy hitters, an opioid use disorder or alcohol use disorder, but recognizing that we all take whatever coping skill we have to the excess can be problematic. So really challenging people to think outside. Is it sex? Is it shopping? Is it food? What am I using in order to cope with my day-to-day stressors that can actually be harmful for me in the long run? So knowing that, being able to identify whatever our coping skill is, and is it healthy or is it unhealthy? And at what level does it become unhealthy? Because not all substance use is problematic, right? There are your doctor may prescribe you prescriptions. You may decide that you're a social environmental drinker. You might have a glass or two of wine and in social settings. But at what point does your coping skill then become problematic? Are you shopping so much that you're having a hard time paying your rent? Have we Are you using sugary foods in order to cope with your feelings? And now we're recognizing our BMI is becoming problematic. So being able to identify, we should think of whatever our coping skills are and evaluate whether they're healthy or not. The other thing when it comes specifically for substance use disorders is that for individuals that are suffering, generally what I hear from folks is, why should I help myself if no one deems me worthy? Like, why am I worth helping? And recognizing these are people who don't know how to love themselves, right? They don't know how to show up for themselves because there's internal stigma. So they feel unworthy. And then society then also says you're unworthy. And we're all guilty of this in some ways, especially when we see homeless people who are panhandling on the side of the road. Most people are so uncomfortable, they roll their window up and they pretend they're busy on their phone because they're not making eye contact, right? That dehumanizes an individual. So really sitting with a person and even just looking at them and saying, I see you, you're a human being, you're suffering, and whether or not we have the tools that we know how to use to meet them where they are, or we find resources to help them where they are and get connected to the right types of services. So stigma being internalized for the person who's struggling with whatever has caused their discomfort, their disease. And then there's societal stigma and provider stigma. And that is also another place where imagine you have an individual who feels so low on themselves and they're really struggling and they reach out for help and they go to an emergency department or they're talking to their massage therapist or their wellness practitioner. And then they ask them, well, what's wrong with you? Rather than what happened to you, right? Inviting that place. The one thing I think that is really helpful for mental behavioral health issues is inviting curiosity instead of judgment. So, right, I'm a harm reductionist through and through. I put on my sunscreen, I wear my sunbelt and my seatbelt. I have a teenager, so if he's going to go out to a party, I give him drug testing strips, just of like, hey, just in case, if you're going to participate in things that might be, risky, let's keep you safe while you do it. Wear your seatbelt, use condoms, do things to prevent harms out there in the world. Um, so I think taking that harm reduction approach is really meeting the person where they are. And sometimes they're not ready to talk about treatment or recovery. Sometimes they just need somebody to be present with them to make sure that they feel alive, that they feel seen. And I use that even with my ecosystem partners. So when I say ecosystem in the community, I'm thinking about fire and rescue and police officers and individuals that work in the criminal justice system. I talk with ER doctors and school, school social workers, and not everybody has the same radical views that I do around recovery. And it's my job to meet them where they are and figure out where they're comfortable talking about recovery and addiction and meeting people with whatever their needs may be. So if they're not ready to talk about syringe exchange programs, that's fine. But maybe we can talk about lock boxes for medications so that kids aren't at risk of using substances that might be harmful for them. So really, to sum it all up is meet folks where they are. If that's individually and personally, is try to understand where you're at in your point in time. Be really honest with yourself of, is this coping skill harmful for me? And am I ready to look at what it could be like if I decided to move into recovery? Same thing for providers or for people who are loving someone with a substance use disorder. It's not our job to fix them. Our job is to create a safe enough space that says, I see you, I hear you, I love you, I care. And what does that look like for you? Right? How can I meet you where you are to see how we can get you back into systems of recovery, systems of society in a way that everybody feels happy and healthy?
You said some very beautiful things, and I just want to reflect on them. The first one was inviting curiosity rather than judgment. That's a showstopper for me because as we go into helping people, the most important thing we need to do is level up and be able to be positive in our approach and curious in how we get to some of the answers. It's really ask and you shall receive. You really have to ask the questions that will get you to a place where you can seek some answers. And I think, there's some beautiful words there that were used. And the other was, which really hit me because I've never heard someone say it so beautifully, was you as a support provider are not there to fix them. And that kind of hit at the bone because I'll tell you why. And as a chiropractor, that made me smile when I said that. is Hope. One of the pieces that I think so many of us get trapped in is I can't fix it, therefore I'm not worthy to be helping. If I can't help and fix it, like a firefighter, if he can't put the fire out, he's thinking, why am I going into the fire? You're going into the fire to save the person. But then the question is, the nice way of looking at this is it takes the responsibility off of you and it adds a level of love that oftentimes if we can't feel the ability to fix something, then we rarely want to try. And this kind of helps you engage with that person that is suffering, especially.
Absolutely.
And I think, Hope, this is a really intense conversation because if you are in some type of addiction and you have a setback, who do you want to be there to help you have your comeback? And those are the people that sometimes they just get so frustrated. It's like, what difference does it make for me to even be here? And
Yeah.
you speak to those people because I think the world is a harsh place in many, many ways. And if we can change just one person, we've changed the world.
Yeah. So, you know, the one thing that I like to really urge people to challenge their thoughts or their behavioral patterns around learning and loving and helping people with addictions, is that addiction comes with this idea of rock bottom, of well, when they hit rock bottom, we can help them. And we don't look at any other disease that way. We don't look at somebody who has type 2 diabetes, who's at risk of amputation on a limb, and say, oh, when you hit rock bottom and put the double gulp down, then we'll help you. When we look at addiction disorders, especially opioid use disorders, that rock bottom can mean death, and there's no coming back from that. So why don't we raise the bottom? There doesn't have to be these stipulations around how we show up for people because it's not our job to fix them. The only thing that we can do in order to make sure that our families and our communities and our practices are more resilient is, again, meet them where they are and figure out how to help them take that step, that next step. It could be as simple as, well, maybe just use less. Maybe we bring in some harm reduction tools. Maybe we go to a meeting and how can I help you get there? I can't do the work for you, but I can say that you won't be alone while you do it.
Yeah, that's incredibly important. It also, for those that have had significant overdose experiences, the person or environment that I have a firefighter friend and also a police officer. They tend to say that they have saved the same people over and over again.
Hmm.
And then I ask them, how does that feel? And the answer is always the same. And it's there's a level of first hopelessness. Like they want to figure out how we keep coming back to the same place with the same
Hmm.
outcome. And thank God I'm there to help. And one of the stories that I can't forget, having crossed the nation back and forth, as a mother who called for help from her early 20s son, and it was his ninth overdose.
Hmm.
And unfortunately, the first responders could not revive him. And as desperate as that situation was, and sadness that was experienced, they could not bring him back to life. And the mother's response was of anger that it was the first responders' fault. And I think this is where it gets very, very painful, because that mother was clearly overwhelmed with trying to help. And that sometimes, we find um, a little bit of hope by blaming someone. And that's not
Hmm.
the case. I don't think that can ever be the case in this type of addiction, especially when it's involving an opiate. Is You can't take responsibility for someone else's actions as a healthcare provider, or primary care physician, or first responder, or even a parent or mother. Can you speak to that? Because I know your experience is so broad and you've seen so much, and it's painfully. Thank goodness there's people like you out there, Hope, that really help lift this conversation.
Well, it comes with my own lived experience. So I had a family member who struggled with opioid use disorder for 25 years. And she's actually the reason that I went into public health. So previous to my public health career, I was a massage therapist. I followed footsteps of my father and thought I was going to, work in holistic health and thought I would help people manage their chronic pain. And I loved doing that. And then I realized watching my sister struggle with substance use and how often the system and that revolving door really didn't help her. And at every intersection of the ecosystem, so criminal justice, hospital systems, education, you name it, there's a crack that people fall through. And I think it's very easy to become hopeless. It's very easy to become apathetic if you're responding to this over and over. But really, recognizing that in order to create change, we have to be able to speak up about it. And we have to be able, to understand what the current drug scape, what the current illicit drug supply looks like. So, one thing that I'll say is that fentanyl is really such a dangerous substance. And what we know in difference to, let's say the crack epidemic or the heroin epidemic, is that those were plant-based products and they had a very different representation and manifestation in the brain and in the body. But fentanyl came in as a totally synthetic substance. So we didn't really know how it was going to process and detoxify or how that rewired the brain. So we know that those um, how those chemicals interplay with the synapses in our brain and our prefrontal cortex and our limbic system and that fear system is that people who really struggle with substance use and really opioid use or chronic substance use is that they've changed the way that their brain is wired. It's really a brain disease. And that's really combating the stigma. So whether it's talking to that mother and saying, this is not your fault, this isn't anybody's fault except for this this synthetic substance that this, poor young man it latched on to his brain and it rewired the whole thing. I mean, imagine the way that I view chiropractors and the brain in general is the electrical system in your house. And if somebody were to come in and flip all the circuit breakers and change all the wiring around, the lights aren't going to turn on the way that you would expect them to. So the ideas and the norms that we have around people who struggle with addiction of, you just need to try harder or you just need to take this medication and it will all be fine is really not the case because the brain and that nervous system, that electrical system is on the fritz. And we're still learning about how long it takes for the brain to be able to heal from that when you start addressing the physical, the emotional, the trauma to really help people rewire their brain in a way that supports them. Um, and that we see that in providers in the social safety net, our firefighters, our emergency doctors, or social workers, and individuals who are accessing recovery, how long it takes them to kind of tune back in and say, okay, I'm going to raise the bottom for myself. I'm going to keep challenging the way that I think about this because you have the opportunity to save a life. And not only the life of the person who's struggling, but the 10 people that love them and support them. So when you can make impact for one person, you're really making a tenfold, the butterfly effect, if you will. You're impacting so many beautiful people who can go out and make a better change.
Such a strong message as we move through the outcomes, which can be, especially when we're talking about fentanyl, because you're right, it's quick, it is such a small amount, and it is horrific when you see a young person who is they go out and they're experimenting in life and they're trying different things and then they come across this chemical and it's like a one and done. It is an absolute reality check. It's the adjusted reality that we're talking about. It's not plant-based. It's really a very caustic substance that the body cannot recognize, adopt, or even adapt to in a positive manner. It is a change of chemistry, and it is a quick change. And when we look at these kinds of moments in our life and we reflect, especially when it comes to our youth, that we want to have these conversations because they're right now, they're right here. And this is a no-go zone. We're not having a conversation about marijuana. We're talking about a very deadly substance. And
Yeah.
that has to be the critical component to having the conversations. It's so important to think about the community too. One person can impact thousands. I mean, the way social media works right now, it can be just as positive as it is negative, although my positive nature means that I want to go with, for one positive gesture, it could make 1 million happy people, and one negative can make 1,000. So I want to stick with that. But you also said something about uh, the resilience of someone who's treating or being in that situation, because it can lead you to apathy because you feel almost hopeless, and if you don't have hope, and I wrote this in the Adjusted Reality book, it's difficult to cope. If
Yeah.
you can't cope, you have to find hope. And it's taking that one person and taking them by the hand and saying that we're really going to work through this together, and that I want to be with you. I want to support you. And I know that this is a chemical change. And by the way, having you said something so beautiful is that there is research out there that we can rewire the brain back to health, that this is not hopeless, that we want
Yeah.
people to understand, and that the more information that's coming out, such as chiropractic, they did it at the VA and they found that the people who were receiving chiropractic care for this type of opioid addiction used less opiates. And like you said,
Mhm.
this is a care plan. This is not, hey, today we're going to the gym for the first time in 3 years, and tomorrow we're going to end up Olympic athletes. We have to have some type of gentle kindness to ourselves and understand, if we could understand that a setback is not the end of the world, it's just the setup for a comeback, and we can have people around us that can really look at that in a beautiful way, we're improving the quality of our communities. We're improving the quality of our healthcare system. And overall, we're taking actions for a better tomorrow, which is, let's really have that moment of reflection. If you had a moment of reflection for your experience, some people could say that they have a drinking problem because when they have the first one, they can't stop with the second or third or fourth. Some
Mhm.
people will say I have two and I have a drinking problem because I always have to have two. Um, do you, in your experience, and I know we've had Anna Lepke on Drug Dealer MD, um, do you see that you could have a problem with a substance, but when you deal with all of the things that are behind that substance use, could you, in your experience, be able to use that substance logistically appropriately without harm? Is that something you've seen?
I have. I do think that there are people who reach certain levels of recovery. You have to understand that there's a continuum of substance use, all the way from no use, beneficial, social, problematic, harmful, full-blown substance use disorder. So for people who really recognize, and by the way, we classify addiction the same way that we do cancer. So you have stage level, stage one cancer, very easily treatable, remediable, good outcomes. You can have a stage four substance use disorder that says, we're really going to try to make you as comfortable as possible as we navigate what your substance use or your cancer looks like for the rest of your life. So it really is a unique perspective. But I have seen people who come back and recognize that they are able to create coping skills and healthy ways to use substances in a way that doesn't derail their life or become harmful for them or a loved one. So it is very possible. I think we recognize that we have a tool belt, right? And in that tool belt, we have all kinds of things that may help us cope with what our day-to-day stressors may be. That can be box breathing, it can be therapy, it can be medication, it can be chiropractic, it can be acupuncture, it can be taking a walk outside. And we all have a full tool belt to use. So recognizing, if you think that you struggle with two drinks, then what other tools can you use to where it doesn't get to the third? Or if you recognize that if you think that you have a problem with two drinks, it is becoming harmful, what boundaries can you set up around that substance or that coping tool to where it doesn't become so harmful? And if that's no use and you're abstinent, that's great. If it's, I can go and have one in a social situation and you're creating boundaries around it to where it's not problematic, that's okay too.
And these are really awe-inspiring moments in people's lives where you tend to, in recovery, you hear as a healthcare provider that they jump to the end before they've even begun. Well, this is the way it's always been, so therefore it's always going to be this way. And it's and sometimes as a healthcare provider, I think we see it in a light of degree, like we rate, like you do, like just like cancer is, 1 through 4. We're looking at a patient on trying to think about tomorrow and not 10 years from now, where a lot of people that are suffering try to get so far in the future that they don't even see today is a beautiful day. And having that box breathing and the walk outside could be just enough to get them through the day. It's like the day by day moment of reflection and who's going to be surrounding you. And that, I think, is why your conversation is such a big public health issue, is we bring communities together to listen, to support, and to play a role in improving the life of one person. Inevitably, it's changing the life of a community and even the world as we take those actions. As the experience that you've had working in this area and definitely being part of the ecosystem for the first responders, what have you seen in the time that you've been working here as one of those moments where it even surprised you that this you didn't even have that in your toolkit, and all of a sudden you were like, wow, I didn't even think of that, but look where we are. What could you share a little bit about those wow moments that have happened in your life?
Yeah, so there's one that particularly comes to mind. Being a chiropractic kid means that I regularly see my own chiropractor, who was lovely enough to connect us together today. And in my work shows up in my daily life. It shows up in my body. It shows up in, in my day-to-day functions. So my chiropractor and I talk about it actually quite often, of the way that, what work stress am I having? What's one thing I wish I could change? And by me educating my healthcare professional, um, I like to make sure that I take Narcan with me everywhere. So for anybody who's listening, Narcan or naloxone is the opioid overdose reversal drug. It's something that everybody should have in their medicine cabinet. You can get it free from most health departments or community services boards. Amazon will deliver it to you for $35. This is a monumental harm reduction tool that should be as normalized as Benadryl and an EpiPen in anybody's medicine cabinet. And I think it should be everywhere. I like to leave it on my living room table at dinner parties as a conversation starter. So I tend to bring it with me to my adjustments, to my hairdresser, anywhere that I might be showing up in space that I can, leave a little public health harm reduction tool where we go. So I'll set the stage. I'm talking with my chiropractor about, I'm having this issue at work and I'm trying to get more Narcan out there and trying to get into spaces where, like food distribution banks, just putting Narcan anywhere. And she said, you know what? I think I would like a box of Narcan. I said, great, let me run out to my car. I'll be right back. And what was beautiful about that experience was that not 1 week later does she call me and she goes, so I left it out in my treatment room, just out there so anybody could see it. And she had a patient who had expressed that he was in early recovery and that he, had been struggling with his own demons and that he had really been trying to work through some of his triggers and just having a box of Narcan there started as the conversation piece for this patient to feel comfortable expressing to his provider what his needs were. So she gave me the feedback. She was like, who knew that a box of Narcan would really be this huge monumental, conversation intersection for me and my patient. And based on that conversation, she started asking me more questions about, well, where do you find harm reduction communities? And how, if I had somebody who was asking for a resource, where would I send them? And did you know that we were able to get her patient connected to a recovery organization right around the corner from her office that they could walk to so that they could find individuals who were thriving in recovery, whether it's early recovery or long-term recovery. But I really think, that one moment, a very simple, here's what I'm dealing with, here's my work struggle, and her curiosity to say, well, what would that look like? And how do I bring that into my practice? Was such a beautiful experience and something that, I'm hoping to continue to replicate and really challenge, coffee shops, chiropractic offices, yoga studios. Um, 1 in 4 individuals in the United States struggles with a mental health or substance use disorder.
It's
That's inc-
devastating news. Yeah, that's devastating news. And it's hard to get the latest on opioid addiction. They being the CDC kind of give us hope that we're getting better on the actual overdose side, meaning the loss of
Mhm.
life. Can you give us a little bit of feedback on where we are in terms of opioid use, misuse, and abuse, as well as the unfortunate stats? A 1 in 4 is a startling factor, and I think it's one that we need to bring up because then every 3 people you think the next one could be that person. And how could you show more kindness in your day? So share with us a little bit of the stats or the experience that we're having in today's world.
Yeah. So 1 in 4 individuals, according to SAMHSA, the Substance Abuse Mental Health Administration Services, says that 1 in 4 individuals in the United States has been diagnosed with a mental or behavioral health concern. So whether we're talking about depression or we're talking about addiction, 1 in 4 people. So knowing that statistic shows that we really should be destigmatizing it. We really should be talking about it more. Having a bad mental health day isn't something to be put into the corner or say, I'll deal with that later. It's something that everyone is experiencing. I mean, if they're not struggling with it themselves, they know and love somebody who might be, right? So that levels the playing field. The other thing when we think about deaths and overdose related deaths, we have lost more Americans due to drug overdose deaths than we did in all of World War II. To let that sink in. In the last 20 years, we've lost almost 1 million people. Um, but there is news of hope. So last year was the first year that we've seen a substantial decline in overdose deaths, 26% across nationwide. I live in the state of Virginia, and we're actually leading the country in a reduction in overdose deaths by 47%. One of the reasons that's possible is because we have naloxone readily accessible for people who need it. It should be free. It should be accessible for people who um, might work with people who use substances, who might have teenagers, who might be with individuals who are at risk, for individuals who are taking pain medications. Anybody that's getting a prescription drug, narcotic, should also be given a box of naloxone just in case, because that is what's saving lives. Along with, we're really building robust communities of recovery. This isn't what we had seen in the early 2000s with dope sick. It wasn't this like new stigmatized disorder. It's really become, I wouldn't say normalized, but it's, we've come a long way to be able to say everybody should have Narcan and talk about their mental health or talk about
Absolutely.
their consumption issues. So that's a highlight. And luckily we're now at an opportunity where we're able to really build it because of the opioid settlement lawsuits. So for those that don't know, Purdue Pharmaceutical recently finalized their bankruptcy suit, and we've got billions of dollars funneled into communities and states and territories for individuals to use on addiction remediation efforts. So when I think about remediation effort, that's across a continuum. I want to talk about prevention for young people, why we shouldn't be using drugs. I want to talk about investing in treatment, investing in harm reduction, early intervention, and really building robust recovery communities. Because the same way that we might deal with an acute injury, working on your recovery and rehabbing your body and your life and your mind is a lifelong process. Put the kinesio tape on if you're going to go on a hike, right? You're walking into a stressful situation. What are the coping skills that you have in your tool belt if you are struggling with mental or behavioral health? Is that taking your medication? Is that taking a time out? Is that not showing up in spaces that might trigger you because you're not ready? That's okay, because we're all meeting each other where we are every day, one step at a time. It's okay to be uncomfortable. It's not okay to be dysregulated in a way that's going to hurt you or hurt somebody else. So we reach our hand out and we ask people how they're feeling, if they're okay. Do they need anything? Is there anything that we can do to be more supportive in a way that aligns with our boundaries and our lives? Because I'm not saying we're enabling or we're going out of our way to meet people in a way that's uncomfortable for us, because the best way to show up for somebody who might be struggling with a substance use disorder is having boundaries. Boundaries for me are self-love and self-regulation. I know what works for me and keeps me healthy and safe so that I can show up for you to be healthy and safe.
That's such an important thing for the care providers too that are out there, is setting the boundaries that work well, and also be able to keep those boundaries no matter how hard you're pushed, because those that are suffering need to see where the boundary is. And
Mhm.
I think that's showing them love when you set what that looks like. And maybe you could explore, because I know a lot of people are listening right now, they know a loved one, or they themselves might be suffering in silence, which is the worst, I think, possible scenario, is to suffer in silence and not say anything and not act or not ask for help. What are some of the tips you could give that perhaps could help someone in their ability to have self-love, showcase their own um, care, their own self-care, so that they can help someone else? Because I think that's a critical part. I know it's overused, but it's hard to help someone if you're alienating yourself. So helping yourself get out of the situation is such a gift that you can continue to give.
Yeah. So I can take that a lot of, we can take that a lot of different ways. But I think, for those of us that are loving someone that might be struggling, it's really, it's not alienating them. It's not saying, I can't deal with you until you're sober. It's saying, I can't have you in my house with my children if you're under the influence, but we can go to a park. We can be outside. We can be in a controlled environment. It's saying, I can't drop what I'm doing right now or give you money for whatever is happening, but I can take you for a meal tomorrow. Showing up in a way that allows us to feel authentic, but also still lets that other person feel human is very important, because it makes sure that they don't feel like a lost cause. Because really, we're all trying to connect. We all want to be heard and seen and loved and feel human connection, right? Addiction thrives in isolation. So, how do we reduce the barriers that isolate them? And some of that is reducing that stigma and having our own self love and boundaries to show them what that looks like, to role model in some of those ways. Um, I think another thing is recognizing that, Again, we're not here to solve their problems. We can't. I can't fix somebody else's depression and anxiety. I can just say, hey, I know on days that I've really struggled, getting outside for a walk or sending over a cup of coffee or something that can change their day and their trajectory. And a lot of the time, it's just holding space. It's, hey, I've got an hour to chat. Are you available? And do you want to talk? And it doesn't have to be about anything serious. Most of the time, they don't want that. So sometimes it's sending them a meme or something funny or a yoga video. Although my sister rolled her eyes at me a lot when I would send yoga videos. But she did always meet me at the park with my kids and always took a cup of coffee.
It's so nice because you, as you were saying it, I'm thinking about holding space, talk, share, walk. It shows how much you care. It's being able to take a bad situation and just put a sprinkle of inspiration into it. Whether it is, like you said, I can't have you in my house with my kids because I don't know how you are going to respond, and I need safety for them first. But I
Hmm.
can take you to Starbucks and go grab you a coffee that I feel comfortable with. It's just something that gives them the meaning that you care. And when you care, that opens the door to share. And that most important outcome that you said, which is so beautiful, is that it thrives in isolation. And that I think is addiction thrives in isolation is something you cannot forget. I got chills down my spine just saying it twice is that, when we were in COVID, we had this isolation moment. And I see now that the mental health, the depression and anxiety has gone way up, the
Hmm.
statistics. Yes, we're not losing as many people from an opioid overdose, but the understanding of what we've been through, and we give ourselves grace that we all made some significant sacrifices and we've lost people, and grief can be a massive isolation problem.
Yeah.
Now it's just respecting and appreciating that just a small gesture can change some big outcomes. And I think that is really a criterion, even just an adjustment, not just like physically and mentally adjusting how you see something, the adjusted reality moment, or adjusting by a chiropractic hands on the neurological system, because we're just understanding it and we're seeing the outcomes in the Journal of Brain, where an adjustment can change the way you sleep, let alone feel, think, do, act, and be. So concentrate on what are some small things that you can do today, and what are the bigger things you can take away. And speaking of biggest takeaway, what would you love to leave with our listeners today that brings forth your message, your mission, your passion? I mean, it's true to form that you were brought here for a reason, and you did such a beautiful job today. And I sincerely, from the bottom of my heart, thank you for for having this commitment to changing the world one person at a time. What would you like your listeners to leave with today?
But they're not alone, right? Um, Communities recover, families recover, individuals recover. Is that there is a whole big wide world out there with someone who may have walked in your shoes and may be able to provide you with some hope or a glimmer or a next step, so that there are people out there that care and there are systems that you can tap into that really do encourage recovery for all. The other thing that I would say is that we really want to meet people with compassion, is that we can all be more compassionate and we show up, especially for people who struggle with mental or behavioral health. I think we can all show a little more compassion in our world, in our community. Lord knows we need it. And that, it only takes a simple gesture, a hug, locking eyes with an individual for 30 seconds, releasing that oxytocin with a complete stranger is extremely powerful. I mean, that can actually save a life. So just be kind.
Well, those, Hope, are beautiful words. And we appreciate the commitment that you've made to not just the space that you hold for addiction and recovery, but also the space of just leveling up what we can do to be better at everything we do. And your passion is overflowing. So I want to sincerely thank you for bringing this message to our listeners on Adjusted Reality today.
Thank you so much for your time. It's been a pleasure.
Well, I want to thank you for joining Adjusted Reality as we spoke to Hope Sievers about her work in addiction, recovery, and mental health. Powerful messages about inviting curiosity rather than judgment, asking and supporting those that are suffering, and also looking at our lives. How can we be kinder to ourselves so that we are kinder to others, and reminding those that are with loved ones that are suffering, you don't fix them. That's not your responsibility, but you do need to get the tools and the guardrails to protect your own mental health. So we want to really raise the bottom. How we show up is through love. Addiction thrives in isolation, and that was a key piece. Holding space and talking, sharing, walking, caring, however you can be part of that positive outcome. That's the key. And I think it is such a beautiful place for us to open the space for this conversation, just like when she dropped Narcan at that chiropractor's office. What an outstanding opportunity to really help those that are suffering. Now, as you know, this podcast was brought to you by the Foundation for Chiropractic Progress. And we know that life moves pretty fast, so we don't want you to miss an episode. You can visit f4cp.org/adjusted reality to subscribe to our newsletter. And while you're there, make sure to pick up a copy of the Adjusted Reality book, 7 Pillars that will change not only how you think, but how you act. And as well, we are looking forward to hearing from you. Do you have a specific guest in mind? We get so many opportunities to hear from you. We love it. Keep them coming. You can also send us your guest recommendations on that page that we just spoke about. Don't forget to subscribe, share this podcast with friends and family, rate and review. That's how we grow, and that's why we love having you listen. If you're feeling so inspired to learn more about chiropractic or to find a chiropractor near you, you can visit f4cp.org/find a doctor. We so appreciate your support. And as always, look forward to checking in with you again soon.